Hello, my name is Sarah Oakes and I am a public health major with a concentration in health studies. Today I'll be educating you on cervical cancer. I won't be able to go into great depth, but hopefully I'll make you interested in learning a little more. As I'm sure everyone knows, cancer is abnormal cell growth that is out of control, and the cervix is part of the female reproductive system. Most cervical cancers start in the transformation zone between the endo and exocervix, and two main types are squamous cell carcinoma and adenocarcinoma, 90% being squamous cell. Etiology and pathogenesis are fancy words meaning cause and development. Scientists have yet to know exactly what causes cervical cancer, but there are many risk factors, human papillomavirus being the most dominant. I'll go over HPV more on the next slide, but first let me touch on a few facts here that increase the risk of cervical cancer. Immunosuppression could be people with HIV or anything else like certain medications that lower your immune system. 3 or more full-term pregnancies or being pregnant before 17. More than 5 years of oral contraceptive use, but the risk returns to normal after a few years once you stop taking the pill. And DES, dithylstilbestrol, was a drug given to women between 1940 and 1971 to prevent miscarriages. Okay, so HPV is neither necessary nor sufficient, but according to the CDC, 90% of cervical and anal cancers are related to it. It's the most common STD, and a majority of women will contract it at one time in their life. Men can get it too, and both men and women can pass it without having any signs or symptoms. Many people's immune system rid the virus on its own, but when the body doesn't, this is when complications will arise. Cervical cancer used to be a leading cause of death for American women, but since the Pap smear, incidence and death rates have decreased by roughly 60%. A new innovation has been the HPV vaccine, which was introduced in 2006. It only targets the two highest risk HPV strands, HPV 16 and HPV 18. North Carolina statistics are listed below, and as you can see, incidence rate, which is new cases, and death rate, also known as mortality rate, as well as percentage that of women who have been screened overall with no insurance and with no provider. Here I have two graphs, one showing percent of new cases and the other showing percent of deaths. As you can see, the highest rate of new cases falls among women between 35 and 44. This doesn't necessarily mean that is when they contracted the disease, but when the disease was diagnosed. And the highest rate of death due to cervical cancer is among women 45 to 54. I also list incidence and mortality rate, new cases, and deaths by race. So screening tests can help prevent cervical cancer, and those include the Pap, which is the picture below the list on the left, which is just a swab of the cervical tissue, HPV DNA test, and a routine exam. The HPV DNA test will reveal if a woman has the high-risk HPV strands that cause cancer. If screenings come back abnormal, further procedures are warranted to diagnose cervical cancer. During a colposcopy, the doctors use a special magnifying instrument to examine the abnormal cells. At this time, the doctor may take biopsies, including a cone biopsy, which is pictured to the right. The endocervical curettage takes a sample from the transformation zone where more cervical cancers are present. If cancer is diagnosed, these are additional procedures that may be performed to determine the stages and severity. With the introduction of the Pap smear, there was also an introduction of precancerous treatments. Depending on the stage of cancer, preference, and suggestion, there are many surgery options in addition to chemotherapy and radiation. Some may be used simultaneously, which will increase effectiveness of treatment. Healthy People 2020 is a government initiative to help the United States achieve better health. You may read this quote I got directly from the Healthy People 2020 website. Healthy People 2020 has overall goals for cancer and specific goals towards cervical cancer, which are to reduce invasive cervical cancer, increase Pap smear counseling, and screening rates. All in all, scientists and doctors have learned a lot about cervical cancer and given people the tools to help themselves. Now we just need to increase the use of such tools. Thank you.